Yo, what's up? I'm Coach Rich Thurman, also known as Coach RT3, and today we're going to talk about your tight hip flexors. Before we get started, make sure you smash the subscribe button so you never miss a post from me. So usually people are talking about they have tight hip flexors, and if I ask them what they do for them, they're like, I stretch a lot and it doesn't seem to be working. That's probably because you're missing a couple of key components about what's going on with your hip flexors. Stretching is only one aspect of strength training. Remember, stretching is going to provide one input, but strength is going to provide a different input for your brain to understand what to do there. Oftentimes, the stretching is putting you in a position, but it's not teaching your nervous system anything about what it needs to do there. So instead of just hanging out in a stretch for your hip flexor like this, instead of doing that, hang out there, allow that stretch to calm down. Spend 2 minutes there. I like to do PAILs and rails there. PAILs stand for progressive angular isometric loading. Rails stands for regressive angular isometric loading. And they're specific to the angle that we're working. In this case, we're working hip flexion and hip extension, right? So the regressive tissue is going to be the tissue on the back, which is the shortened angle. The progressive tissue is going to be the tissue on the front. After we've hung out here for 2 minutes, what you're going to do is you're going to begin to load that tissue. And we're going to load that tissue by trying to drive the knee down and forward, creating an isometric contraction of this tissue in the front. We're going to ramp that up slowly over time to our greatest effort that we can control and that we feel comfortable with. And then we're going to reverse that and try and pull back using this stuff back here to squeeze and try and drag this bone, the femur, backwards in the joint. One of the other things you can consider is strengthening through eccentrics. So an easy way to go into eccentrics would be to load in a similar position. I wouldn't suggest using a weight straight away, but I would suggest just trying to get familiar with trying to load your eccentric. So here, my left leg is acting as a little bit of a support, so I can use as much of that leg as I want to support myself as I move forward into this hip, and I'm loading that tissue there, and then I'm driving out of it. So I'm loading that tissue there, slowly putting more weight, more weight, more weight as this tissue lengthens, and I'm driving out of it. You can then add a weight or something that you carry here in order to do the same, and then you can move that into kind of a lunge position if you want to progress it even further. The final thing we should consider is the fact that length tension of your muscles is not just about one line of tissue. There are multiple lines of tissue that make up all the stuff along the front of the hip. So it stands to reason that if I put my hip in internal or external rotation, I'm going to get a different stretch and a different line of tissue, which may be your limiting factor. So when you think about being in this position here, if I go into hip internal rotation, I'm going to get a slightly different stretch when I go into that hip extension and stretch this front side than I did with my leg straight forward. Also, if I move my leg into external rotation, I'm going to get a slightly different stretch of different tissue or a different line of tissue, which may be another limiting factor in how your hip is able to move and how your hip flexors feel. If you found this video helpful, please hit the like button, share it with somebody who needs to hear this, and subscribe to my channel for more great stuff about strength, conditioning, and mobility.